One of the major causes of type 2 diabetes is fructose in fruits. But people with diabetes should also eat fruits for its goodness. There is a study of over 100 female patients in the US on what kind of fruits are good or bad considering the risk of type 2 diabetes. Studies of over 100 men and female with follow-up. Let's look at the top 5 fruits for type 2 diabetes. Blueberries, king of the fruit, decrease the risk by 33%. What does it make it so special? It is the purple colored anthocyanin, highly contained in blueberries, apples, and grapes. Anthocyanin can activate the enzyme AMPK, which increases glucose uptake rate in tissue and muscle and reduce glucose production in the liver through gluconeogenesis. It also increases insulin secretion in the pancreas, and it improves hemoglobin A1C and triglyceride levels. So, anthocyanin intake through blueberries is linked to preventing diabetes. Grapes. Grapes and raisins are the second most powerful fruits for diabetes patients. Resveratrol or polyphenol found in grapes suppress insulin resistance. Grapes decrease the risk of diabetes by 19% due to resveratrol in grapes. It increases insulin sensitivity in the body. It would be best if you ate the grape peel because there is a lot of resveratrol in the grape peel. If you don't want to, try mulberry. The flesh in it is rich in polyphenols. Fronds. Fronds have chlorogenic acid, which reduces glucose-dependent insulin secretion. Chlorogenic acid reduces fasting blood glucose in clinical trials. It also increases glucose uptake in the muscle. And fronds are a good choice because taking fronds make you feel full and reduce the amount of meal in the day. Apples. In a meta-analysis study, the apples and pear diet shows that consumption of apples and pear was associated with an 18% reduction in type 2 diabetes risk. Apple also contain a high amount of anthocyanin for its anti-diabetic works. The phenolic and antioxidant content of apple with fiber helps to reduce the risk of developing type 2 diabetes. Grapefruit contain anthocyanin and naringin. The naringin, like sitagliptin, diabetes medicine, similarly inhibit the DPP4, which inhibits stimulating insulin secretion and suppress glucagon secretion. Naringin just acts like a drug, and this can lead to glucagon-like peptide increases, and as a result, improve the body glucose tolerance. But grapefruit has many interactions with orally taken medications. So ask your doctor before you eat. One thing you should remember is to eat whole fruit, not juice or powder form. Fruit juice without fiber pushes lots of fructose into the gut and burden the pancreas to release too much insulin, which increases insulin resistance eventually. These fruits are a healthy choice because not only of the compound in them, but also the fiber, which lower glycemic index. Try to avoid tropical fruits, which have a lot of sugar in them. Wish to find your best fruit for a healthy life.